Can trauma explain secondary psychopathy in criminal behavior? Imagine someone who seems charming on the surface but struggles with emotional control and impulsivity. Could their past experiences be shaping their behavior? That's what we're exploring today. When it comes to psychopathy, there are two main types, primary and secondary. Primary psychopathy is often seen as something people are born with traits like emotional detachment and low anxiety. Secondary psychopathy, however, is linked to emotional instability, impulsiveness, and a history of trauma or difficult childhood experiences. Research shows that people with secondary psychopathy often report early traumatic events like abuse, neglect, or witnessing violence. These experiences can interfere with normal emotional growth and attachment. When a child faces trauma, their ability to regulate emotions can become disrupted, leading to difficulties in controlling impulses and increased aggression. This emotional dysregulation is a key feature that sets secondary psychopathy apart from primary. Studies involving violent offenders and juvenile delinquents reveal a pattern. Trauma exposure, especially in childhood, is connected to higher levels of antisocial behavior. Even when controlling 4 psychopathic traits, trauma still predicts a greater likelihood of criminal acts. This suggests trauma doesn't just influence emotional development but also plays a role in criminal behavior. Understanding this link has real-world implications. For offenders with secondary psychopathic traits, trauma-informed therapy might be more effective than traditional approaches. Since their behavior is rooted in emotional wounds, addressing those wounds can help reduce impulsivity and aggression. In contrast, primary psychopaths often show emotional deficits that make traditional therapy less effective. So, can trauma explain secondary psychopathy? The evidence points to yes. Early adverse experiences seem to contribute significantly to the emotional instability and impulsivity that define secondary psychopathy. This makes it a vital factor to consider in criminal psychology and behavior. Recognizing the role of trauma helps in profiling offenders and tailoring interventions that target the root causes of their actions.